Good morning, everybody. Thank you. Well, actually afternoon, we're already at noon already. For coming to our Latino Research Institute information session on our different research projects. We're glad to have you here. Everybody should have gotten a goodie bag from us, so you're good to go. We have one of our speakers, Dr. Vanessa Arisuis, was feeling ill, so we had to do a Zoom to get her in to talk to you guys today. So she'll be talking about her project via Zoom, and we're also recording just to post on our website in case some people wanted to come and they weren't able to make it, they can hear the different projects that we'll be talking about today. Okay. All right, let me see if I can. Yes, it worked. Okay, so we're gonna just give you a little bit of background on what the Latino Research Institute is. For short, we call it the LRI. We're gonna tell you who we are and give you an overview of the different projects that we have that have openings for students to work on them. And then afterwards, we'll have a little question and answer session. Since we're only like 4 people, we can all talk because it's a small group. Usually, like if it's bigger, we'll split off into like different groups to do the Q&A. Goodness. Oh, there it goes. Okay. So the main purpose why the Latino Research Institute was established is to do research on Latino populations. We know that there's disparities, not just in Texas, but other states for Latinos. So we focus on physical, economic, and the cultural well-being of this population group, not just here in Texas, but also, as the US as a whole. Oh, sorry. There we go. And then we know that there's different health disparities among Latinos, among different chronic diseases. So they adversely affect them. And it's also in relationship to context, like where Latinos live, other economic aspects. So the LRI focuses on research to advance scientific knowledge to help Latinos with these determinants of health. Like I said, it could be economic, social, environmental that affect these different chronic illnesses. And then we try to translate our research, like all these numbers that we get and all this data, into products that can be used by the community and that can help people, not just people, but like organizations or institutes, like community-based organizations that work a lot with populations to help the communities that they serve. So the main mission of the LRI is to provide infrastructure for creating and also disseminating quality information about Latino populations, not just in the state regionally, but also nationally. We're working on different collaborations, trying to establish like research networks with Mexico and Puerto Rico to try to help scholars and extend and disseminate our research to other areas. And the way we try to achieve our mission is through establishing different partnerships. And these could be, like I said, with community-based organizations that work in the community, like schools, or it could be with like federally qualified health centers, which are clinics that serve disadvantaged populations in doing our research. We also conduct health, social equity, cultural studies. We also have been doing a series of policy briefs, like with, and I don't know if Dr. McDaniel wants to talk about it when she talks about it, but she was part of our COVID consortium. And with that, they did like a survey of, I believe it was physicians and of students. And with that, they were able to develop like a policy brief on how COVID was affecting students. So we try to, have our research, but have it serve a purpose. We also want to build and strengthen pathways for Latinos to get into research careers. There's not a lot of Latinos in PhD programs. So we're trying to help undergraduates, graduate students, and doctoral students strengthen their skills to be able to apply to those programs and, be up in the ranks. And, while you're up there, you're pulling other people up and helping them once you're, have your PhD and doing your research. So why would a student want to become involved in research at the LRI? So there's different ways, and you might be here for different purposes. It could be like for a thesis or an internship or program requirements. We've had people that have interned with our research scientists, like as part of the URAP program. Also, it might just be that you're interested in learning a new skill that you've heard about and would be interested in trying, or you think will be applicable to you in your career as you advance through college. Or it could be you might just have an interest in social justice and would like to become an active participant in our research, since all our studies or projects have that tone. And also it could just be that you want to earn course credit, which is one thing we can also provide as being involved in our research projects. So another thing also, implicit benefits that you might not necessarily think you'd get, but you will receive these as being part of our teams on our projects. Cultivating good habit formation as part of a team, you'll be assigned tasks. So you'll learn like time management skills, how to prioritize different tasks, which will help you like when you go out to work or even, into a PhD program. Learn and develop like what your personal values are. These values are like what'll help you like where you want to be in the future, like what career trajectory you want to do. Also gaining skills that you'll learn here in the workplace, but it's also transferable either to a job you will have in the future or anything else. So a growth mindset is basically that you can learn any new skill. It's not that you have all the skills already in you and you can't learn anything new. So you'll be learning new things that you might not necessarily, be exposed to like in your courses, your undergrad courses, but you'll be able to learn them through our research projects. And then also professional development. You'll learn networking with our different collaborators that work on our projects. You'll get to learn new people, learn communication skills, like how to write an appropriate email to like the professors you're working with or even people in your team. Team building exercises because you work in a group on a project. Also fostering independent thinking. Elsie here is my graduate research assistant. She can tell you like we work as a team on the projects that we do. And I ask her opinion and I just don't delegate stuff to her. So it's like a mutual relationship. Also the unknowns of academia. So a lot of us have gone through the process, undergrad, going to graduate school, applying to PhD. So we've gone through the career path and we can answer questions for you if you have questions. So we're also there for you in that sense. So these are the folks that will be presenting today. So in lieu of Eva Villanueva presenting, Nova you're her undergraduate research assistant, correct? So she's a current undergraduate research assistant. So she's going to be discussing the project that she works on with Eva. Eva's on here virtually, but you can also ask Nova questions if you'd like. I know you have to leave because you have class. So if you want, after she presents, if you have questions for her, please ask them after she presents, because she has to go, and then we'll continue with the rest of the presentations, okay? Okay, I think you're first, Nova. I'm gonna go over here.
Okay, so hi, my name is Nova Roscoe. I'm a current undergraduate research assistant with the San Jose Research Project. So what our study is, it's a community-based study to prevent drug misuse in Latinx youth. So what we do is basically we work with families in the community, in the Austin community, who attend the San Jose Church. And we do a parent intervention. So it's this certain intervention that was created to specifically address certain issues that immigrant specific families face. So it's basically like a parenting program, but with a twist that it specifically acknowledges like the certain struggles immigrants face. So it's about like how to raise your kid, it's also about how to talk about racism you may face or xenophobia you may face as a child of an immigrant or as an immigrant yourself. We're looking at low-income Latino immigrant parents in Travis County, like I said. And so our participants, usually the parents are foreign-born, so they're from a certain Latino country. And then the youth that we work with, they're 11 to 15 years old, just because that's like the perfect time range to like kind of catch certain behaviors, and so that we're able to make a change. So what we do is we're on our third cohort right now. So this is basically, we're doing this in waves, and there's two parts to each wave. Oh, sorry. We have our intervention and our wait list group of our cohort. So that basically means when you're doing a study, you kind of have your independent, your dependent samples. So our intervention is people who are receiving the study, the parenting class right away. So we have that plus the wait list. So those will be the people kind of waiting till after the intervention people receive their class, and they'll be receiving the classes after them, just so we can compare like how the classes are with these people versus people who aren't taking them, with also like providing the intervention to both groups rather than just totally excluding a group. And so the way it works is we conduct 3 surveys to each parent, and it's usually 1 or 2 parents participating. At least one has to participate, and then it has to be only 1 child. Even if there are multiple children in the family, we're only looking at 1 child. And so we do 3 surveys. The first one is before they take the intervention or the parenting class. And then the second time we take this survey will be right after they take the class, or like soon after that they take it. And then the third time we do it is 6 months after they finish taking this class, just so we can kind of see and gauge how it might have made a difference or it might have not. And yeah, so the intervention itself, it's a few weeks long. They have a class where we get together. The UGRAs aren't part of the class, but the people who are in the study that do, they conduct this class. Lately has been over Zoom because of COVID, but basically the parents all get together each week and they discuss their certain topics. I have had the privilege to sit in on a few of these, and it's really interesting to see because you get to talk to the parents when you're conducting the survey, but to actually see them like engaging with the material and applying it, it's really interesting to see. But yes, and then I think that is good. And we're also federally funded, so we're also trying to, this is also the first time we're doing this through the church, because I believe we've done it through schools before. The study has been conducted before, but through schools, but we had an issue with immigration and like ICE and going into schools. So since churches are more of a safety, like a safer place to be because ICE aren't allowed in churches, we're now doing it through church just to make sure that our participants feel safe in participating. But yes. Does anybody have any questions?
So if you do have questions, if you want to take down Emma's email address, it's on the bottom of the slide, and you can reach out to her if you're not comfortable asking her or not. Right now, you can ask her questions and follow up with her. Eva, is there any? Sorry. Eva, is there anything else you want to say?
Hello, can you hear me?
Yes, we can hear you. I don't know if you want to say anything else. No one had any questions, so.
Yeah, no, and Nova, thank you. I think you did a great job in explaining the essence of our project. Right now, we are looking for 2 undergraduate research assistants. This is a paid position to start in the fall. And it will be the same position as Nova described, is data collection before, after, and 6 months after the intervention. And we're looking for your undergraduate research assistants that are, committed to this population and that are also bilingual.
Yes, we're looking for 2 people, as me and one other undergraduate research assistant will be graduating this semester and during the summer semester. So if you have any questions, I can also give my email if you want to email Eva. We can talk to you a little bit more about what we do. specifically what the undergraduate research assistants do.
I know it would be a good resource if you have questions, because she's doing what you would be doing.
Yes, and it's almost, it's gonna be this November, I think it's just gonna be my second year with the LRI, so. Yeah.
Thank you so much. Thank you, Noel. I'm next. Okay, I'm next. Hi, everybody. So I'm Dr. Morales Campos. I am the coordinator, the area director for training programs. So I manage these information sessions. I'm also a research assistant professor. So I also have some research projects. So one project that I'm working on and that I'm looking for assistance with is I got blessed with doing a literature review on HPV vaccine hesitancy. So I'm looking for some assistance with this. These are voluntary positions, but it'd be great experience, like I said, for skills for when you go to graduate school. So this is basically a review article where we're looking at different dimensions of why parents would be hesitant to give the HPV vaccine to their children. So we would I'd be reading along with you articles, and we'd just be like creating tables just to pull to see what information there is available, and you would get credit for assisting with writing the paper. This is a manuscript that's actually already it was solicited to be, put together and made, so it is gonna be published. So this is one good opportunity if you're interested. So like I said, it is a literature review. It involves looking at data archiving, which is the different articles that we have on this topic, and then just like picking out information and like filling out a table just to classify it according to themes is what we'd be doing. The other project I have, oops. Okay, here we go. So this study's already been completed, but I have data that hasn't been analyzed. This was also involving HPV vaccine hesitancy with Latino parents in the Lower Rio Grande Valley. So we did interviews with mothers and the daughters. And there's also recordings of the conversations that the provider, so the doctor, had with the mother when they went to go visit the doctor for their well-child checkup. So it'd just be basically, you would learn qualitative data analysis coding if you're interested in doing that. And so you would help me code the transcripts. And if you're not familiar with qualitative data analysis, you like do the codes, and then you have a program that actually does the summaries for you. So I could teach you how to use Atlas TI, which is the program I use. And you would help me with coding the transcripts and pulling together the summaries. And like I said, if you assist me with that, I would also give you privileges to being on the manuscript, since you help me with coding the data and summarizing it, to do like the results section for a manuscript. So that's one plus. And the participants for this particular study, well, I already told you, are the parents and the caregivers, the girls, and the providers at the clinics that we worked with for the project. And you have my email there. Please feel free to email me if you have questions. And I'd love to hear from you guys. Anybody? We'll do questions for us at the end, since we don't have to leave. So I'll go to the next person, and then we'll do questions after everybody goes. I think Vanessa, Dr. Arisudis is next. Yes. Okay, I'm just gonna go off because she's on. Dr. Arisudis?
Hi.
Okay, there she is. Okay.
Sorry I couldn't be there in person today, but I'm glad I could join you all via Zoom. So I'm here to discuss a couple of studies that I work on that deal with chronic disease prevention. One is the Salud study. As you may be aware, diabetes is a big problem in the Latino population. In fact, Latinos are about 2 times more likely to be diagnosed with diabetes than a non-Latino white individual. And so the purpose of this Salud study is to develop and examine the effect of a culturally tailored diabetes self-management education program for Latino families who live in the Eastern Crescent here in Austin, Texas. And for those of you who are unfamiliar with the term Eastern Crescent, Eastern Crescent refers to an area of Austin that starts north 183, like in the Runberg area. It circles around east of 35 and then comes back down into the south part of Austin. This is primarily where Latino and other minority families reside. And so some of the effects that we're looking for include impact on blood glucose levels, so reducing A1C and increasing quality of life. And participants in this study will be an individual with diabetes and one family member. So we'll recruit our participants in pairs, and we are in the process of finalizing our online lessons. So essentially participants will be randomized to one of two conditions. So randomized means they don't get to choose their condition. It's kind of like a flip of a coin. So they'll either receive a usual care condition that gives them YMCA family membership and access to one session with the YMCA personal trainer. We will also give them educational materials that describe how to manage diabetes through blood glucose monitoring, increasing physical activity, healthy diet, and stress management. And then the other program that we have to offer is Salud Salud. So this is a usual care plus program. So they receive everything that the usual care participants receive, plus an additional nutrition consultation with a registered dietitian. They also receive a 12-week online education course to help them manage their diabetes, as well as weekly meetings with a community health worker to help them goal set and problem solve as they attempt to learn these new behaviors to manage their diabetes. So there's a lot going on. It is the beginning of the project. So we are working on participant recruitment. We will be collecting data, and we will be working to develop a website or some kind of social media page for this study to assist with recruitment. So we are collaborating with YMCA. The research opportunities for this study include experience with in-field and remote data collections. So you'll learn things like collecting height, weight, waist circumference data, in addition to collecting HbA1c, which is blood glucose data. You'll also gain experience with data entry and management and development of bilingual program resources and materials. So if you are bilingual in Spanish and English, you are, of course, who we're looking for this study. If you are not bilingual in Spanish and English, that's okay. If you are interested in participating, we will have both Spanish speaking and English speaking participants. So there's room for everybody on this study. So next slide.
Did you have another slide, Vanessa?
Oh, I guess not.
Okay.
Go ahead.
Okay.
I think so. Camera's right.
Okay, I'm gonna go like this because this is a weird angle. Hi, everyone. My name is Dr. Monica Mcdaniel. I am a postdoctoral research fellow here at the Latino Research Institute. Actually, it's my last week here. So I'm gonna kind of give like an overall, and yeah, I'm going to a consulting group. That's another research opportunity that you can do with your doctorate in public health or your PhD. Anyway, so the data services group, our main purpose is to support LRI's scientific mission by providing state-of-the-art research services and sophisticated technical and computing support. Basically, it's where all the data lives. And so we have our hands in a lot of the other projects, a lot of the data is there, but there's so much that we need help with in the data services group. One big thing is policy brief development. We have a lot of studies that have been completed or are about to be complete, and we want to get that information out as fast as possible and not wait the year for it to go through the whole manuscript and review and all that. So we need help just getting information out. So we need policy brief development. So that can be data visualization, actually kind of like just the skill of breaking down a really big research project and putting it in a couple of sentences for people to understand. And something else we need help with is overall survey development and testing. This may be for smaller projects that come into the DSG. So for example, right now I'm working on a project, prescription practices for Latino LGBTQ communities. I think that's the official title. But basically what we're doing is surveying physicians to figure out why is there such a big PrEP gap. So Latinos are almost half as likely to be prescribed PrEP in order to decrease their risk of getting HIV. So we're trying to figure out what that PrEP gap is. And so it's a smaller project, so it lives within the data services group. And we'd help, well, not right now with that project, but with other projects like that, with creating the survey on REDCap, as well as testing the survey, as well as testing with other people to make sure that everything is running smoothly in the survey. And with that, on the back end of most surveys, as well as anytime we collect data, we have code books or data dictionaries, which we need to help developing, as well as construct tables. Construct tables are any type of like tool you see, like perceived stress scale, or any type of scale you see. We need to know exactly where that tool came from. So when we're writing papers, we can of course have the reference. So we really need help with kind of going back, and if we did not happen to document where we got said scale or measure, we need help with like getting all that information, again, to help us write papers. What else? Survey data verification is for data that was initially collected on paper, not online, or it could be something where something that we may have forgot to do on the REDCap survey, like some type of validation for a number, for example. The data, we need help with going through all that data. And if people, for example, put that they are 5'3" versus their inches, someone has to go in and like go into each individual record to make sure that it's clean. We need help with that, as well as database management in general. Sometimes we put together different databases. So that's also a training opportunity for getting more training in coding and like the back end type of database management, as well as data archiving of all this data, and we need to put it somewhere so other people can use it. And we are in the middle, and that's a huge project that we're working on at the data services group. And something that we are kind of opening ourselves up to, and something that we really haven't done as much in the past, are like qualitative studies. So we need help with not necessarily the interviews themselves, because we have some interview data, like such as the actual recordings of the interviews or like the actual audio recordings. So we need help with transcription. And with that, after transcription, quality check, as well as coding the data itself, like thematic analysis or grounded theory thematic analysis. So it's kind of overall, I mean, it's basically everything data. If you're interested in data, the data services group is for you. If you have any type of experience with coding or computer science, or if you don't have experience with coding computer science and you want to have more experience, then the DSG is for you. And Dr. Zhang, you want to talk about maybe some specific projects?
So we're planning actually I think we were planning to open a paid position, or we are also looking for volunteer position beginning this summer or in the fall. Specifically, right now we have tasks to work on the code book. We have data set like from other scholars who already retired, but they never had a chance to kind of like clean up the data. We need to build up the code book for like future scholars who want to use it, to give them clear like guidance structures, or anyone with like basic like stats background, any information like background in like coding, comfortable with coding, or like even you're open to learning that, we're open for like people trying to. So basically we just provide support. That's one of the projects, but also there will be other projects. So for example, for Salu, like currently we are developing surveys on RecCap. That's something the data service group is also working on. Once we develop the survey, we're testing it. And there are some other projects is already in the archiving stage that says it's already down with like the recruitment and then the study design and all that. And now we have all the data counting, but we need to kind of like arrange it and manage it and then kind of like make it more prepared for scholars who want to use it. So basically it's more so with support kind of like task on the back end. Yeah, I think if you have any questions, feel free.
And
Yeah,
my email's down.
I'll add mine.
Yes. And we'll send out some more information about emails. And my email has, if you do email me, you'll get my other personal email, so I'll still bring them in.
Dr. Morales, I think that was the last slide.
Okay, well, if you all have any questions, yeah, we'll be happy to answer them.
My only question is if we are interested in